I now call the December 7th, 2023 Senior Citizens Advisory Board meeting to order. Has this meeting been properly noticed and posted in compliance with the Nevada Open Meeting Law?
Yes, it has.
Thank you. Would the Deputy City Clerk call the roll, please?
Chair O'Rear-Cameron.
Present.
Vice Chair Weinstein-Hall. Excused. Member Paderetu.
Present.
Member Galati.
Present.
Member Mosdeen.
Present.
Member Drum. Excused. Member Lee.
Present.
Member Graham.
Present.
Thank you, Chair. You have a quorum.
Thank you, Deputy City Clerk. Item number 3, public comment. Comment during this portion of the agenda must be limited to matters on the agenda for action. If you wish to be heard, come forward and give your name for the record. The amount of discussion, as well as the amount of time any single speaker is allowed, may be limited. Seeing and hearing none. Item number 4, for possible action to approve the final minutes by reference of the regular meeting of October 5th, 2023. Do I have any amendments or a motion?
Member Mosdeen, I would approve the minutes as written, so I suggest that they be accepted as written.
For the regular meeting of October 5th, 2023, correct?
Yes, for the minutes of
you.
October 25th. Thank you. October 5.
All in favor?
Aye.
Aye. Any opposed? So moved. Item number 5, presentation by Maria Reed from Senior Medicare Patrol regarding health literacy for seniors. Thank you. If you could just state your name for the record.
Maria Reed, and that's R-E-I-D. I'm a benefit counselor and outreach coordinator for the Medicare Assistance Program in Nevada. And I'm here to start out by saying many people are not aware of what happened 3 years ago. There was a merge, and the SHIP, Medicare, the Senior Medicare Patrol, and MIPA, they all merged, and it is now falling under the Medicare Assistance Program Office. And we support Northern and Southern Nevada. Reno actually has the office for Northern and in the Las Vegas and Henderson area, and Pahrump. Everywhere else, we have offices in Henderson and Las Vegas. What I thought I would do to give you, I would hope, a better understanding as to what we actually do on a daily basis, I'm going to do what I'm calling Did You Know? And so these are the type of questions that are coming in from beneficiaries, family members, caregivers. And it all has to do with navigating through Medicare and hopefully finding some cost-saving measures for them. So my first Did You Know is you're eligible to enroll in Medicare at 65. Did you know that you could delay that? If you are currently employed, you're still employed, you have coverage through your employer. Then you can decline Part B. And there's no penalty because it's not going to be late when you enroll at a later date when you no longer have that group coverage. And that also applies to your spouse. So for instance, I retired 5 years ago. My husband retired prior to that, but as I continued to work, he was under my plan. And he declined for several years. And then he enrolled in Part B when I actually retired. Did you know that there are actually 2 options as far as your Medicare coverage? There's option A, which is your original Medicare, sometimes referred to as traditional, and that's the three-parter. Part A for hospital, Part B for medical, and then D for your prescription drugs. Then the second option is your Medicare Advantage plans, and there's over 40 in Nevada, and you would either enroll in an HMO or a PPO. So the biggest difference between those two is original Medicare, it goes with you. Out of state, any state, wherever they accept Medicare. Medicare Advantage plans, you are restricted to the networks in your plan, which happens to be Clark County. And many people are not aware of that. So even though You may be out of state. In case of an emergency, it's covered, but otherwise, no. My next, did you know? Whether you have original Medicare or Medicare Advantage, you can make a change in open enrollment. Today's the last day for this year. It started October 15th and it ends today. Any changes people make, the effective date is the 1st of January. However, did you know if you have a Medicare Advantage plan, you have a second opportunity to make a change, and that is January 1 through March 31st of every year that you can make a change. Many people are not aware of that. They also are not aware of the fact that whatever option you take when you first enroll, you can change it. Some people think once they select their plan at initial enrollment, they can't change it, but you can. Did you know about Medigap plans? Now that is a Medicare supplement plan. It's a true supplement plan, and if you are in original Medicare, as you know, you're covered at 80%. So a Medigap plan covers the 20% that Medicare doesn't. And it's a separate premium, and when you first enroll, when you're first eligible, it's a guaranteed issue. Now in Nevada last year, they implemented the birthday rule, and I think it's a beautiful thing because under the birthday rule, with a Medigap plan, the month of your birthday and the following month, you can make a change. You can go to a different company, the benefits will be exactly the same, and it's guaranteed issue. So I'm not sure if you're familiar with them, but there are 10 plans, so varying levels of coverage. If you, let's say you're in an F plan and birthday rule, you might select as a C. That would be lower benefits. They allow you to do it, but the catch is you would never be able to go back to F. So we want people to keep that in mind. Now, did you know that Medicare would never contact you and ask you for your Medicare number? They don't do it. Your providers don't do it. But unfortunately, the scammers are out there, alive and well, and they're very creative, and they are fooling a lot of beneficiaries. They really are taking advantage of our seniors, I think. Now, did you know, as far as billing errors, they're not all intentional. Many times the calls we receive, a beneficiary thinks they are. This is fraud. Sometimes it's truly just an administrative error, but it is something that can be fixed, and it's a matter of getting a hold of the provider. If the beneficiary wants us to do that with them, we do. So it's a third-way call because we're not able to call for the beneficiary. It has to be the three of us together. Did you know that if you have other coverage, it's important that your claims are submitted to both insurance companies? And we also advise, if you're in original Medicare, you're receiving a Medicare summary notice, which shows you the claims that are submitted, whether or not Medicare approved it, and if they did, how much was paid, and is there possibly an amount you would be owe to pay. And so that's one way to look to see whether or not any fraudulent claims are being submitted under your number, and it happens. And an example would be, and it happens, a wheelchair was submitted under a beneficiary's Medicare number, and it was fraudulent. When the beneficiary did in fact need one, Medicare denied it because they already issued it. And it's difficult to get through those, to get those reversed. And you have to wonder, okay, I'm going off, but you have to wonder, who does that to people? But they do. They do. Now, did you also know that as far as detecting fraud, obviously it's through your Medicare summary notice. If you're in a Medicare Advantage plan, it's an explanation of the benefits. But you're doing the very same thing. Look at it and just confirm, yes, I received those services on that date. Sometimes we receive a call because a beneficiary doesn't recognize the provider's name, and usually that's in instances of, for instance, an x-ray or a radiologist reading the x-rays, and they don't know who that is. But again, it's just a matter of getting a hold of the provider to confirm. Now, I wanted to mention that with the recent recertification with Medicaid beneficiaries, we have received an increase in calls where they need assistance with transportation, to and from doctor appointments. Dental care is a huge one. We receive those calls every week because original Medicare does not cover dental. Medicare Advantage plans do, but Medicare Advantage plans don't work for everyone, and it's usually because of the provider network. So we find that our seniors, many of them, are in very difficult situations, but we do have resources available to share with them. Unfortunately, many of those resources, they're volunteer basis, and they don't have as many volunteers as they used to. So the dental, transportation, vision, and also that's really low-income housing. They need help with that, finding it. And what's interesting is Social Security refers them to MAP, and so does Medicaid. So I wish there was a one-stop place for all of these because we continue to gather new information and build our database, but, and I just did that on Wednesday. There was a veteran who needed dental care, and thank goodness for the internet. I was able to find 2 resources for him, and he was not aware of them. And so our jobs are difficult, and I think the difficulty many times comes with the fact that the resources aren't there and we aren't able to help them. Did you get a better idea of the kind of things that we address with beneficiaries and family members? It's what we do every day.
I'm Vito Galati from Ward 2. As I listen to you, the information is all here, and sometimes it's mind-boggling for anybody who's not aware, especially the seniors. And my first question is, how do you disseminate the information?
So what we do is we actually, we do present at the libraries, we present at senior centers, the senior living, so like for instance, Carnegie Heights, Cactus Valley Resort, all over the city. If they invite us, we go. We also are at the health fairs, and so we have information tables. But I really have noticed people don't know who we are and what we can do for them.
My other question is, are the doctors receptive to have that in their office and the hospitals?
What's interesting that you say that, because I received a call yesterday, and the person had just visited their doctor. They had an appointment, and there was a Medicare Advantage person in their lobby, which sort of surprised me, but maybe I shouldn't be. So they're selling the product. You'll see them at the grocery stores or in the malls. But we don't do that because what we do is counsel. We advise. In fact, people will be irritated with us because they want us to tell them, tell me what plan to take, and we don't. We basically present questions, what do they need to consider as they select a plan that best fits their needs. But so the libraries, which is really surprising to me, but maybe not, the attendance when we do our presentations, they're so low. We're also, we are now part of OLLI, so at UNLV, and we are there every semester. And we noticed that even though the numbers aren't great, what we're doing, though, is we are getting the information out. Those who are in the class are talking to their peers, and so that's another way. We also have managed to recruit volunteers, and they are now per diem employees. So it's a good place for us to be. But if you have suggestions as to how we can get this information out, I'd love to hear it.
Well, one would be for the media. In other words, you would need additional funding.
I know.
But that you, because most of the seniors will be watching television, whatever it is, and I notice this is the time of the year, thank God it's ending now, but you're barraged, one after the other, and that becomes a reality, which is not. They're selling a product, and of course the usual, the fine print is on the screen so minute that you would need a telescope to read it. But again, that would be a good start if some funding could go for local television to at least once in a while, because
Right.
other than you presenting this, I had no idea.
I know. I'm so glad to be here. Thank you
Yes.
for inviting me. But that's what I need to hear.
Yeah.
Yeah, Deanna Weir Cameron, that's exactly why I wanted to have you here, Marie, because that's the biggest thing that I've seen just year after year is the Advantage plans are very, very out there. And I have helped so many older adults avoid the wrong plan just by letting them know you don't want someone to make the decisions for you, and by getting the information out there that you need to look forward. It needs to be the doctor you love, the prescriptions you take. And those are the things that you counsel with people without telling them. And I think it's beautiful. And I think it's very understated what you do. And I do see you at everything I go to. So I know you're out there. But I think it's just because the market has literally been drowned out with Advantage plans. And honestly, I speak about that when I'm on my commission meetings, because I feel that something should be done about that, because we shouldn't drown out the actual counseling that's there to help make the decisions. So I thank you guys, because you really do go everywhere. It's just, unfortunately, I think it's that watering down that gets out there. And I know that you do so much. And I did have two questions.
Sure.
So I know the January, 1st through March 31st, but I know when I've been around some of the Advantage plans, just hearing things they're saying.
Yes.
Sometimes I hear that during that particular, like they have a special enrollment period for certain conditions. Like there was something, I'll just say diabetes, even though that I don't remember if that was one of them, but I've heard them talk about that. Is that something? I mean, like this January 1st through March 31st, they don't have to have a specific health reason.
No.
They can just
So
change.
any Medicare Advantage plan,
Wonderful.
you could either switch to another Medicare Advantage plan, or you could go back to original Medicare.
And see, all these years, and I did not know that, because I was under the impression that it had to be for some specific, that once December 7th happened, that was it, you're
Right.
stuck. And I didn't know that, so that's huge, and I want to make sure everybody's hearing that for the record. And then the other thing is, I know a lot of them really don't, just out of, I guess, apprehension, fear, I don't like that word, but it happens, and you and I both know that, right? When they get that EOB or the Medicare summary,
Yes.
they don't understand it,
Right.
and they have almost a mental block. And I'll be honest with you, the calls I get, they say my provider's not helping me with it because they're too busy. They're not calling me back. They're not this. So does that mean if they call your office, you can
Sure.
at least help them through it?
We can help them.
Okay.
And we would also help if they are, if a claim was denied and
Okay.
they want to submit an
Perfect.
appeal, we will help them do that.
That's wonderful, because that's the biggest thing I noticed is they want the hand-holding. We get that all the time.
And just so you know, our calls, if we take a call and actually resolve it, close it, if you do that within 30 minutes, that's amazing.
Yeah.
Because otherwise, I finished working on a call and it was over 4 hours.
Yeah.
But it was over multiple days, but it was total 4. And it wasn't all about Medicare.
Yeah.
It turned out part of it was Medicaid, but
Yeah.
we worked through it with them.
See, that's wonderful, because you're not going to get that. There's no time for that at the
No.
doctor's offices, because we already have a shortage of physicians and nurses. So, that's why I wanted to make sure that you can handle that with them.
So even when I was hired, which was 3 years ago, my interview was really interesting. It was almost one question, one requirement. You need to be kind, respectful, courteous, patient. And it's true. You really do. You do. So, any more questions?
Yes, Elizabeth Portoretto. So if you are on a Medicare Advantage program, and sister, there is another enrollment coming in January, ending in March, so we cannot switch back to original Medicare at
You
that.
can.
You can.
You
Okay.
can.
So we can get asked for a Medigap at that time.
Okay, so when you're first eligible for Medicare, and you enroll in Part B, you have to have A and B to enroll in a Medigap. But it's only with original Medicare that you can have a Medigap. So Medicare Advantage plans, you are not eligible for a Medigap.
So currently I have a Medicare Advantage, and they're also charging me extra for medications and even
Okay.
with that. But I was asking for one particular doctor. He's my doctor for 30 years, and he is in Intermountain. So Medicare, original Medicare don't take him, or I don't understand is a problem. So if I revise, because I asked my agent to ask the revise, he said this is the best plan. So I'm thinking, because it's the Medicare Advantage, and like you said, I'm a traveler, so it's only will be covering me in Nevada again, Clark County. So I think I should switch it, but I can switch it to Medicare in January if I
Yes.
want to.
And then your question as to if that's what you do, can you apply for a Medigap plan? I'm not sure if that was your question
Right,
as well.
right.
You can apply for a Medigap anytime. However, if it's not during your initial eligibility period, which that's where you fall, then your application goes through underwriting. It's not guaranteed approved.
Okay, so
But you
can we
can
do
apply.
it in next October, open enrollment?
You already missed it. Okay, I should ask the question. When did you go to Medicare Advantage? When did that start?
2022, November.
Yeah.
Yeah.
You're past.
So,
So you can apply, but it will go through underwriting. It may be denied.
okay, so but if next October, open enrollment, can I just automatically go to Medicare and a gap? Can I do that or no? Medigap? No?
So you're outside of the initial enrollment period for your Medigap. So as far as you're concerned, should you decide to go back to original Medicare, and when you do, that's when you would apply for a Medigap plan. It will go through underwriting. It's not automatically approved.
Okay. So if somebody is healthy, we'll be okay? I mean, like,
Yeah.
it's okay, good enough. Thank you.
Okay, Charles Lee. If I'm enrolled in the original Medicare Plan B, can I opt out of it?
Well, you can, and then the question comes, why?
Okay,
Do you have other coverage?
okay. So what happens is my wife. I still work.
Okay, so she's
And,
covered under you?
Yes, she's under my insurance.
Okay.
And she has Plan B.
All right. Oh, if she's covered under yours,
Yes.
she doesn't necessarily need Plan B. You're paying two
Right,
premiums.
exactly. So is there a time frame to opt out of that?
That's a really good question. So that actually is with Social Security that you want to decline. So you could actually do it online as well. So the only cautionary note is, once you lose your group coverage, whenever that is,
Right.
make sure you enroll in Medicare, whether it's original Medicare or Medicare Advantage.
But-
So she's covered under you, she's fine.
Right. And she's covered under A and B.
Right.
So, I was telling her, I said, well, we don't need B. Well, you don't need B since you're covered under my insurance.
Correct.
Right. So I wouldn't have to wait for an enrollment period
To decline, for her to decline,
to decline B.
that's what I think. If I were you, I would or I could take your name and your phone number, and I will
Okay.
find out.
Okay.
Okay,
All right. Thank you.
we'll do that. And then there's one more thing before I go, and that is with the prescription drugs. And who knew that the cost, the copay, is different where you go? It's not the same. CVS, Walgreens, Costco, they're all different. And they also are all different if you're in a Medicare Advantage plan by plan. And so we really advise people, when you compare those Medicare Advantage plans, list your prescription drugs, because then you get a fair, an accurate estimate as to what your costs will be. A gentleman called, he said his drug premium kept going up, or his drugs, his co-pays with Medicare Advantage, and he didn't know why. So we pulled up his account, and I'm going through his drugs. Is this list current? No. We removed almost all of those drugs, and it brought the premium, his options, down. He couldn't believe how much money he was going to save. But again, people don't know that. Yeah, they don't know. And then there are 2 ways you could also get discounts, and that is with the Good RX and also single care. So that's outside of your Medicare coverage. But those are great ways to save money.
I just have a comment. I might have made it in the previous discussions that we had on the topic, is that from personal experience, that for premium drugs, there seems to be a special wording. And it has happened to my wife that she needed a particular blood pressure medication, but it was ridiculously priced.
Yes.
But if she mentioned may use that particular one, in other words, the catchword is may use whatever, they will send that. Otherwise, if she said, well, I would like to have this instead because it's better for me, the prices are usually ridiculous. So they'll go into the, in other words, you get generic, but if you want the prime ones, you have to say, according to our plan, may use or may replace with.
Oh.
And I was wondering whether there's something that you can clarify, or is it just, I don't know, it's mind-boggling.
Right. And actually, that would be a question for her doctor. So what you normally see is they will offer a generic. So you'll see that on Medicare.gov.
But if you want the other one, you have to say may use, and automatically that comes in at the same price, at the reduced price. Otherwise, you're paying premium price.
Yes.
So I'm just wondering whether the pharmaceutical companies that have gotten together and created this little niche that hardly anybody knows about, and if the doctor doesn't mention, of course, you're going to pay for the expensive ones.
And then for an example, that single care discount, and it doesn't cost anything to be a member, enter that drug on that website. It's an app. Put it on your phone. And I was so surprised because I received a new prescription. I went to pick it up. It was $133. I said no. And then I went to single care to check it out. And instead of $133, I'm paying $49 somewhere else. But who knew that? People don't know it. So single care or Good RX.
Yeah, I use the Good RX.
Yes.
And it's really amazing how it will list out the price at each of the pharmacies.
Yes.
And like you just said, they're all different prices. So while I may be used to one pharmacy, I can actually save like $5.
Yes.
And I was shocked recently. I had to have some medications. And I mean, I think they costed me $6 total by going through GoodRx, which when I was going through coverage, it was so much more. So sometimes, and it really is, like you said, working with the doctor. So that's what I've noticed.
Yes.
If I do telehealth, I make sure and let them know that this is what I saw, and I'll look it up on my GoodRx right away so that they can send it to the proper one. So it does take us a little more effort, which I think the average person doesn't necessarily do, but you know, and I have to thank you also, because most everything that I have learned about any of the Medis is through you, and then through a gal who literally writes books and trains others. And without your organization and her, it would have been hard for me to help any senior, because it is so detailed. You know, I mean, listen to us on the board. We all have our own situations, and that's how it is for each and every person. They have a different diagnosis, different doctors they like to use, different prescriptions they're on all the time, and, you know, it all needs to be discussed all the time, and I think the doctor is the front line on that. And I just think that if the doctor's not helping you, you need to find out why and kind of demand it. I know they're busy, but we need to make sure we're getting the care that we've been promised to have. So I think that's part of it too. But thank you so much.
You're
That's
welcome.
great.
I
Anyone
just-
else with a question?
One question on the good Rx. If you have already a prescription plan, how do you work with that? You would
Because
have
it's separate.
It's separate.
It's separate.
So you have to see the difference in savings that you would
Yes.
get. Yeah, thank you.
Elizabeth, here I have a question about regarding the MAP program, the financial assistance of $1,000 to $4,000. How do you apply that to anybody? Because they said there is a financial assistance at the bottom of this card.
Okay, so what that is referring to, there are a few. The first one is called Medicare Savings Program, and that's actually administered through Medicaid. And it confuses everybody because Medicaid will pay the premium for Medicare if you're on Medicaid. Then there is a program called Extra Help, and that is administered through Social Security. And they pay the premium for your drug plan and your copays. And then there's a program called Lynette, and that's for somebody who's transitioning into Medicare, and they're just working through their application, but they need their prescriptions filled, and they're able to do it through that program. So it's a temporary fix until their application goes through.
This is not basing on any financial status of the person, or is it? Like, if the person can afford to pay for something, this program will not help, but those who are not able to, is the one they're going to step in and do it?
So there are a few programs out there that could possibly help them with their premiums, but there aren't many.
Thank you.
And then with the material that I gave you, my number is there. It's the 702-616-4926. So call me, ask for me, and even though I work part-time, I will get the message. So I will call you back. So will you do that? Okay. Call me. Is that it?
Caroline Mosdien from Ward 6. Maria, do you have additional handouts, additional supplies that we can
I do.
use for our
Sure.
our locations?
Yeah.
That would be a big help, too.
So, okay, so can I work with you to getting, okay.
Okay, that would be excellent. And just a quick response to Vito. Vito, if you, I know a lot of doctors are not crazy about this, but in the past I have asked for written scripts. And asking for a written script, at least you have the opportunity to shop it around, as opposed to, if you've got it in your hand, you can check your Good RX or Single Care and look at that list. And sometimes they are right, and sometimes they're not up to date, but at least if you go in, you have the opportunity to show that to them without giving it up, because otherwise, if it's been sent to somewhere, unless you know that that's the place you want it sent, you can get, a little cumbersome. So try asking for a written script.
Any other questions or comments? Okay, thank you, Maria.
welcome.
Thank you so
Thank
much
you.
for bringing the information to us. We appreciate you. Item number 6, report by Gregory Gray, Management Analyst 1, Department of Neighborhood Services, regarding senior issues received by the Department of Neighborhood Services, all wards.
Gregory Gray, Department of Neighborhood Services. Just a few updates. So we are, in regards to Charles' request regarding the Doolittle entrance, we are currently talking with Parks and Recreation and as well as our Deputy Director in regards to providing funding to change the entrance. There may be some conflicts with the master plan for Doolittle, so we're just waiting for approval from the Deputy Director with Parks and Recreation. We are bringing on a part-time staff starting next week to further supplement our senior services efforts. Her name is Olga Flowers, and she will be at the next Senior Advisory Board meeting to introduce herself to you all. And that's all I have to report at this time.
Thank you. Item number 7, report by board members regarding senior issues and events within their council wards and at large, all wards. And first, we have Ward 1, Nicole Graham.
Hello, good afternoon, evening, whatever time we are, right? For Ward 1, I've been working with Councilman on just this holiday meals and treats, going through the variety of senior centers. Stella Fleming is left for this month of December, Jamestown and Decatur Commons twice this month. So just working through the holidays with him on a couple of those meals and fun activities within the senior centers. That's it for Ward 1.
Thank you. And Ward 2, we have Vito.
Yes, I attended the monthly breakfast get-together with the Victoria Seaman, Councilwoman Victoria Seaman, and it's always nice to be there simply because it's the largest gathering for seniors to attend, and usually it's very informative. On a normal basis, there's always a representative from the Summerlin Area Command, and many times will be the captain himself of the area, which is, we hear it directly from him, very informative, or his representative. And usually concerns seem to repeat themselves, traffic, crime, and the homeless in Summerlin. Also present is the city marshal, and they are responsible, I guess they represent anything that belongs to the city, parks, buildings, and they also are empowered to do what the local police do. Again, it's nice to ask questions and know that there are two different agencies that cover, and many a times we just address or we ask for the area command, but they also at parks and so forth, there are different, there's another number that you can call if that be the case. And because Vegas has about 130 different facilities that are covered by the marshals, and even enforce traffic violations. Again, I'm not recommending that you call city marshal for any of these, but again, it's an option, and people that attend these meetings are aware of it. Also, the presentation tonight, there's going to be the yearly Christmas get-together at a local restaurant in Ward 2. And again, it's nice to see that the councilwoman extends herself to get as many people as possible from the ward. Very limited, even though it's always posted out there. But again, it's a nice event. Thank you.
Thank you. And did we ever get Yvette by phone? No? Okay. And then Ward 4, because Jennifer is absent as well, correct?
Yeah.
Okay, just making sure nobody phoned in while we were going through this. So Ward 4 is myself. And since we did not have the meeting last month, I too want to talk about these first Tuesdays with the Metro, and I absolutely love the one that we did in November with the Summerlin Command up at the Starbright Theater. Greg was there, Councilwoman Polensky was there, somebody from our MORE team, was it, Greg, right? He was there, and there was a hospital representative there from Summerlin Hospital, and several others, and I must say it was so informative. First of all, I understand that now we are calling them unhoused rather than homeless, just so everybody knows. Oh. And there was great discussions about first of all, they went over some information on the L2K, which is the form that the Metro will look at and fill out and check the boxes, or maybe not be able to check the boxes so that they know if they can take this person over to the hospital, which was so important for us to know. In fact, I think I need to send everyone here the L2K so you can kind of see it. I had to ask for one too because I haven't gotten one in so long. And it was really just so interesting to hear how they do the process when they're called out on the situation. And with these check boxes, it lets them know if it could potentially be a mental health situation, and then they'll take them to the hospital. And then the hospital, which I did not know, actually has like their own little court system in it. So it's kind of interesting, these details that were there, and honestly, I wish I had a recording of it that I could just play and send out to everyone, because that was amazing, and I tried to take as many notes as possible, but I wanted to be as focused as I could on that information. And then what's happening is when they pick up these people and the check boxes are marked for the L2K, what will happen from there is then they will look at where there's an availability at a hospital. So it may not be right in their location. And so that's what's happened, and was bringing some concern to Summerlin residents, because when they go over to the Summerlin Hospital, when they're released, they're released in that area. They're not necessarily taken back to where they started. So that's why you will start to see a lot more unhoused. And I've actually been seeing more of that than ever, and had an actual challenge with one at our apartments that was literally breaking out the windows, a lot of things that were happening. So it was perfect for me, because I was able to get some questions answered, and I'm happy to say that person's not there anymore, and hopefully getting the assistance that they need, because you cannot, because of the rules, find out what's happened to this person. But I think it's important for all of us to know that information, because you will get those calls. You will have a neighbor talking about it, somebody. So I don't remember the number to the MORE team. Greg, do you have it memorized? You always have everything memorized. So that way people know that you can call there if you have an unhoused situation. And what I also found out is that when it's on private property, you will be calling Metro. When it's not on a private property situation and it's sidewalks or behind a commercial building or in front of the commercial building, then what you would do is you would call our MORE team. They're the ones that'll handle it. And I had no idea there was 2 different routes to call. So that MORE team number for everyone is 702-229-6673. Again, 702-229-6673. So if it's in a public space, that's who you will call. If it is your private property, or your neighbor, whoever's talking about it, then you will definitely call your station for Metro. And so I will get the L2K for everyone. I wanted to spend a lot of time on that more than anything. We are not having, Councilwoman, because it's the holiday month, is not going to be meeting at the YMCA for those of you in Ward 4. And there's obviously limited events in December, but we will be getting back started with all that in January. And then also I wanted to make everybody aware of actually an event that I am doing at the East Las Vegas Community Center. So that would be under Councilwoman Diaz's area. And it is on January 11th in the evening. And I am so grateful because Matt Paxton, who has a top show on PBS called Legacy List, he was formerly with Hoarders. And so I absolutely love what he does. Is he will have people bring objects and help them with, the memorabilia side of it, because one of the things he says is objects won't jump into piles magically to recycle, donate, discard, rehome, repair your memorabilia photos, and there's no magic decluttering app or a secret pile sorter. So what he does is talks about what's standing between your goals is the what ifs and I remember when, and he helps people with the decluttering. And one of the things I can tell you is I know Greg and I both have had actually calls in this area with hoarders and, neighbors that are, I heard that laugh. And so it is an issue. And so that's why when he said, well, he's here for CES, he'll do this event. So if you want the information, I'll give it for the record, but then I'll also send a copy to all of you so that if you want to attend it, it's going to be very well attended with older adults and their families. And that is it for my report. And now we have Ward 5, Charles Lee.
Hi, it's Charles Lee, Ward 5. The only thing that I have today is restriping of the streets. A lot of people are having problems at night seeing the left turn lane. And they actually had some incidents where people run up on the curb. They can't see, where they're supposed to enter to make the left turn. And I believe if some more reflective paint is put down, that would help the cause.
I have a suggestion as far as, I would call it your council person and let them know, because they will then call the highway department or whoever. It might be more practical. I had to do a call like that with the bicycle path locally because it hasn't been painted for about 10 years and you can hardly see it.
Exactly.
And of course, every little bit helps, and not having that line and it reflects also, it protects a little bit the cyclist. So in your case, I think I would do that first.
Okay.
Yeah.
Jeff Dorgak, City Attorney. Member Lee, when you get locations on things like that, you can pass them along to me and Gregory because we'll send them down into traffic, which is in our Public Works Department.
Oh, that means if I don't see any results from my bicycle path, I'll call you?
I think we met our veto quota for the year, so we can't take any more requests from you. Yeah.
On that note, too, I forgot to tell you, Vito, that I literally trying to get the Secretary of the State's office in here for all the voting things that you bring up, so I promise I will make it happen. On the line of those. Anything else, Charles?
I second that be on the record.
No, that's it for me.
Thank you. And Ward 6, we have Caroline Mosdeen.
Thank you, Madam Chair. Caroline Mosdeen, Ward 6. First of all, I hope everyone that's listening has had a wonderful and safe and happy and healthy Thanksgiving and are looking forward to the rest of the holidays as they come about in a big hurry for most people. Rather than going over what we did, I'd like to just make sure that people have an idea of what's coming up. First of all, it's not in Ward 6, but it is in Ward 4, and it is something important. On December 9th from 10 a.m. to noon, there's a household hazardous waste drop-off. So that's at the Mountain Shadows Clubhouse on Delwood Boulevard. There's lots of things. Most of the shredding events and events of that sort don't cover that. So I'd like to make sure that people are aware of that. Also, something that many people, particularly seniors, but everybody really, is subject to and might be interested in, is free home security survey. This is done by the LVMPD. They have a service. You would contact the crime prevention specialist at LVMPD, and they're available to come to your home at no cost to conduct a security assessment. So in today's world, it's always a good idea to follow up on that. The assessments usually take 30 to 40 minutes, and by all means, just get in touch with them for that. Also, starting in August 1st, 2024, all dogs and cats over the age of 4 months are going to be required to have a microchip. Microchipping is not terribly expensive, but if you have several dogs or you're on a very limited or any limited financial situation here, there is going to be a free microchipping session, and you do need an appointment, but you would go to visit online or give them a call at the animalfoundation.com, so you could get hold of free microchipping for your animals. I'd suggest you do that as soon as possible because there is a limited number of chips available at no cost. On a more local basis for Ward 6, Saturday, we passed Cowboy Christmas, so now we're into the Christmas festival. And please excuse me if I mispronounce this, but it's Posada Equestre, which is a Christmas festival. It's on Saturday, December 9th. It's an equestrian parade at the Teton Trails Park, which is on Bradley, right off of Grand Teton in Ward 6, and then a celebration at Bradley Park. And there's a lot going on, including steer rope show, barrel racing, dancing horses, folk ballet, Christmas carol singing, toy giveaway, candy tossing, and a piñata raffle. And it's a free family event with food, coffee, and hot chocolate. And Ward 6 Councilwoman Nancy Bruni will be there and probably riding a horse. I was not aware that she had spent so much time in South America. I believe it's South America, or could be Central America, where she rode only a horse for transportation for a few years. So she is going to be there, and it is, again, it's a free and open for the public, and it looks like it's good for people of all ages. There's a breakfast with Santa on December 16th, and if you don't feel like you're part, maybe you've got grandkids or someone else in the family or friends who might be interested in that, and that's at the Centennial Hills Y on North Buffalo. And lastly, dollars are tight for everyone, but if you do find yourself with a few extra dollars, there is a giving tree located at the Centennial Y, also on North Buffalo. If you have a little extra and you can share it, you can pull a card off of the giving tree and fill the wish for younger children. Thank you.
Thank you, and thank you for talking about the word for toxic. It's one of those days. Forgot that one. Just looked at my notes. Thank you.
If I may add something, you mentioned that, is it going to, the microchip is going to be in your ward? There will be an event?
No.
Oh, no. I thought of it as you mentioned that I'm going to approach a councilwoman, possibly to have some sort of event locally. Who knows? Throw it out there, and maybe we'll get more, because sooner or later we all have to do it if we have pets.
That is correct, starting
and
August 1st. And it's listed as the Animal Foundation at 655 North Mojave Road. And they've teamed up with Las Vegas for that, and it's going to be in the month of December while supplies last. So it is something that is kind of, time sensitive.
Yeah, I'm just wondering whether it can be done locally or that you need for the process. Equipment.
Possibly. When I was in New York, we would often have a reduced rate, one by inviting a local veterinarian clinic, and they would come and offer them at a reduced rate. But this is one step better.
Yeah, what I can tell you, Vito, is that would be actually something you would go ahead and ask Councilwoman, because she is a major, major pet advocate, and she probably has either already thought of that, or if she knows there's an assistant like you who might, step up or something. So, absolutely, yeah. And I would definitely bring it up to your councilwoman. And next we have Ward 6, Elizabeth.
Elizabeth, it's good. Elizabeth from Ward 6. I hope everybody's having a good day, and we ate too much turkey, and get ready for the ham that is coming up. Anyway, I wanted to back up with your legal L2K, because I was inside that for a while. Mm-hmm. So yes, we can, somebody who is taking a person without that form, any police or somebody, they think they without their permission, they arrested the person, they took them, so the family. So in order to avoid that, they're doing the legal form, they're taking that. But the hospital has to evaluate the person, and then usually they have the time of 72 hours, up to 72 hours, staying in the hospital. If they are under drugs or something, if they wean off, they will be able to leave the hospital. But if not, then they had to hear the court hearing that is by video directly. Every hospital has it now. People don't have to be shipped to the court system. From there, they will decide whether the person has to be stayed in the hospital. And then after that time, most of the hospital, if that is not accredited by JACO, they are not a behavioral hospital. They cannot keep the person in there. That is the reason they only have very few hospitals in town. So no matter where they are from, this person will be transported to that hospital by the hospital only very strictly, because those hospital has to be protected, highly secured, because these people can jump any fence and they can destroy. And everybody has to be very strong to stand withstand their abuse. That's why, so if you think, oh, I live in Summerlin, my person is taken to Mojave, yes, that's the only place they have a bed, it has to be put up with that. So that was out of my experience. Thank God I'm not on legal hold anymore, I'm out. All right. Month of October, I went for the presentation by RTC for the YMCA. People were, and their questions were answered. People were they got a real good orientation how to get a bus or RTC pass, or how to travel around when safely, and all those things were given. And also they were given a discount pass. If you are a senior, you're already eligible for a discount pass, so it's like half price. Once you have that, you show that and put the half price in or you can get a pass. So those are things, but they said that we can call them for any further questions. But most of the people who were there were well answered, and they even had a tour with that person, like training them how to do the certain activities, and they all came back very happy. I was there. Now, coming to this month, Caroline already told a lot, but she missed the luncheon. Surprise. She don't eat much, but it's coming on the 13th at 11:30, and the dress code is gray and white. And they said they're expecting about 90 guests, plus there are 10 employees who is going to serve. And so they were upset. Nobody from city or council attended their Thanksgiving party. So please show up and support them for that event. So for the luncheon at 11:30 on December 13th, Wednesday. So, and they had the director or whoever, the lady in the Centennial had a complaint. Their garden and their surrounding is not being cleaned. The bushes are outgrown, they are everywhere, and it doesn't look anywhere close to neatness. So I even take a look at it, and their contract is with Brightview, and they said they haven't even been there for a long time. So she said, can you talk about it? I said, I will talk about it, but I don't know what will happen. So that is all about me. Yeah, thank you so much, and hope everybody wishing you a very Merry Christmas.
Thank you.
Thank you. Item number 8, discussion for possible action regarding next steps and future meeting topics of the Senior Citizens Advisory Board, all wards. I do know, as far as this particular agenda item, we do have a robust amount of things that we've talked about at each meeting. And I know they're on our minutes, and we are reviewing those. And like I said earlier, one of the things for you, Vito, is I'm going to get in the Secretary of State here.
Thank you. Well, as the discussion, I just thought about it. I know we used to have someone, a doctor coming from UMC, and during the COVID situation, I just happened to read an article about 4 days ago about the releases of patients and issues facing that. And we all use our logic and fill in the gap by putting the information that we think is logical. And we say, no, this doesn't happen. No one is going to be released, because most of the time, I know it's from personal experience, no one is going to release you unless you have someone there at the hospital to be released and so forth. However, after reading the article, and was not addressed, was exactly what's the procedure, what's the legality of having releases, and how come you have even one falling through the gap and being left on the corner of a street who had coverage, not contacting anyone, just putting out of the hospital. The liability, that should be a major concern of the hospital, but maybe nothing is being done. Perhaps we can have someone here to clarify that for us, a representative, and also address those issues. How come that happens? I would really like to see that. I think we could all benefit.
So just for a little bit
Vito
of
and I-
clarification, there are like social workers that work at the hospital that do work with patients in regards to discharge planning. However, the sentiment that they will not be released because they don't have any, without securing a place to go is not true. So what will happen is that they don't have a place to live, to recuperate. They will be discharged to or sent to the shelter. In our case, the Homeless Resource Center at the Courtyard. So that is one of the situations that we are dealing with as the city. And we also have a recuperative care center through the city that is a response to those that are unhoused that are dealing with medically fragile issues, which you guys have done a tour of. So in a sense, you guys have received information in regards to unhoused and improper discharges. As far as who would be the person to speak to that, that will require a little bit more research on my end as to who the appropriate individual would be. But as far as a city response, we are more than happy to have Maurice Cloutier with Homeless Services come and talk about the Courtyard's efforts, as well as Jocelyn Blewett-Fisher with Health and Wellness talk about the recuperative care center's efforts. And then hopefully we'll have someone from the medical side to be able to answer the concerns that you brought to the board.
Elizabeth here, I can speak a little bit about that because I was in that area for a long time. The people who are eligible to be discharged from the place will say discharge to self-care or home. If they are alert, oriented, and able to walk around, that is the situation. Then we will ask them whether you have a family member to pick you up. No. Then we will give them a shelter address, and we will call them and tell them such and such a person is referred to you, will be coming there, and we will give them a bus pass because they are able to be in a bus. But what most of the people will do, throw everything away, and they will walk to the street and sit there. So what we instructed them was different, and what they're doing is different. So the hospital, in my experience, I was working in that unit for over 10 years. That was not the hospital because we did everything. They shut the paper and every information we gave to them and put it in the trash and we'll go. Most of the time they sit there on the driveway or somewhere in the corner. They walk to the next hospital. That is a behavioral problem. They have a behavioral issue. So we are taking so many times we get so sentimental about things after it's not that our emotions are not going away. That person has some responsibility. Individual responsibility has to be taken by that person. It's not a city or a community or nobody. That person is responsible for them at that moment. Sorry.
Yeah, and so I know Vito and I discussed it a little bit before, the meeting, and I said exactly what you just said, Greg, because I think some people from our health and wellness team who are getting, these calls and dealing with these situations would be beneficial. And then also someone from, the actual health system, because while these things are happening, there's always like two sides to every story, and that's what we need to hear, is that side, and then also the side where we're receiving them. Because the biggest concern I know for me is I know there's a procedure, and I know we're receiving them, but I'm trying to figure out the ones that are in hospital gowns, and they still have the IV thing in them, and how that's happening. So that's the kind of thing that should be brought up and addressed on, how that's happening. And that doesn't mean that there's blame anywhere. So when we're going through this process and having the speakers, I think it's really good for each and every one of us to have an open mind and listen to both sides of it. Because as Elizabeth stated, we have a huge mental health problem in Southern Nevada, and we do not have enough resources for that. You can go to any meeting where Metro is, and that is the first thing they're going to tell you. Actually, two things that Sheriff will tell you. Sheriff Kevin will say every time, we don't have enough of the mental health resources, so they end up being repeat offenders. And the other thing he will tell you is we need to look at who our judges are. I'm just being honest about what he says. So that's why I say there's more than meets the eye to everything. So if we can get speakers along the lines of each aspect of it, so that we're not perceiving things incorrectly, And so that we can find out where the gap is, because that's what we're all concerned about, is that gap, right? We're concerned how somebody can be in a gown, or the different ones, and we want to know what that is and what that means, and we want it to come directly from the people who are dealing with this.
And just to add on to that, Madam Chair, it is also a matter of consent. So while medical staff and agencies will recommend a solution or proper planning for discharge, it all comes down to consent. If they are not willing to take that recommendation, it ties the hands of the agency as well as the healthcare professional that is dealing with that individual. So, and that's also with what our police deal with, it's what our staff deal with, is the fact is that I can make all the recommendations in the world. If you say no, I cannot force you. There's no law in place to say that you have to get the services that will make you healthy and strong or mentally stable. So that is one of the barriers that we face when it comes to dealing with those individuals. And sometimes it takes some rapport and relationship building. And I know we're kind of getting into the weeds here discussing this. It's supposed to be future topics, so I'm just going to close it there.
I just want to adjust a little bit. I know we all want to leave here.
It's not about us wanting to leave. This isn't on the agenda for discussion. This is only for topics.
Right.
So
Yeah.
just for the sake of staying within the item, I do see that there is some discussions that would be warranted from this particular topic. So I would recommend that we hold any future discussions or comments for the actual meeting itself.
Thank you for the direction. And item number 9, citizens' participation, public comment.
Madam Chair, can I just interrupt before you start that?
Okay.
Caroline Mosdeen, Ward 6. For the future also, but it's got to be in the near future, I was actually going to ask the board if they knew a little bit more about AARP or other tax assistance, since that will be coming up very fast. I'm having a little trouble in Ward 6 coordinating that. We have people that are upset with the registration and things of that sort, and I was wondering if other wards had any help, or if any representative of a ward had a helpful idea about how I can get that straightened out. But if not, if we want to put it on for next month, we still have enough time.
So we do tax assistance programs through the community centers, especially the active adult centers. So we'll definitely check with Parks and Rec staff as to when that will occur. Usually it's like February, March of the beginning of the year, which is run to the centers. They usually take the appointments. There's at no cost to the seniors. But I'll definitely look into the information, and we can also see if a representative from AARP will come and talk about.
I would appreciate that, because, as I said, we're kind of tripping on each other over at the Centennial Hills Y about appointments. One person says the appointment goes this way, somebody else says we haven't got the time to answer the phone, so you've got to put in for an appointment, and people are getting a little distressed about it. So if we can, follow
Yes.
up, or if you can give me a number.
We receive those calls as well, unfortunately, because it is so late in the year and not close enough to the time to when the program is actually starting. There's no way to really book an appointment at this time, and there's not any program information available to answer the questions that they have right now. Usually it's until we get closer to the actual program itself. So again, I will, we did receive those calls. I'll make sure we get that information. I'll talk with the supervisor over the senior centers to see what they plan to do in regards to that program, and I'll also touch base with AARP to see when they'll be implementing their program.
Thank you very much, Gregory. Yes, a cohesive coordination would be wonderful. Thank you.
Thank you. Yes, those usually come out in January each year, is what I noticed. I mean, the planning and the parameters. And then, Gregory, if you need any assistance on the AARP side, I have contacts for you. So that's perfect. Thank you. Any other discussion regarding future meeting topics? Item number 9, citizens' participation. Public comment during this portion of the agenda must be limited to matters within the jurisdiction of the board. No subject may be acted upon by the board unless that subject is on the agenda and is scheduled for action. If you wish to be heard, come forward and give your name for the record. The amount of discussion on any single subject, as well as the amount of time any single speaker is allowed, may be limited. Seeing and hearing none, our next Senior Citizens Advisory Board meeting will be January 4th, 2024 at 1 p.m. here at City Hall. And on that note, I wish everyone a happy holiday, however you celebrate, and also a really wonderful new year. And we will see you on January 4th. We are adjourned.